Hello, everybody. Good morning.
Good morning.
So, welcome to the BLS Instructor Renewal course. And my name is Eunice Mathis. It's a pleasure to have you here. We talked about safety earlier. We have the one-way in, the one-way out. That's our emergency exit. If you need coffee or nourishment, we have a beverage station also. Restrooms are all the way down the hall. Is there anyone who needs to use the restroom before we get started? Right? All right, and so I always like to talk about our why, and because I do a lot of recording, I always try to switch my why up. So today I was thinking about, Eunice, why do you do this? I do this because I remember being a very young nurse in 1999, oh my God, so many years ago, being certified in ACLS, and that's the advanced courses. And this is what I do all day on the job. This is what I was doing. My first job was cardiovascular step-down unit, but we actually had an intubation ward where we had people on vents. And so we did cardiovascular care all day. But I'd go into a room with doctors and nurses who had on white coats and would lose everything. It's like, okay, this is what I do. Why am I so nervous? And so one of the reasons why I teach the way that I teach is so that when you go back, when you teach others, it's less intimidating, they actually have fun, and they learn. And so that's what I want you to take away from today, is that you can have on a white coat and still teach others without making them feel uncomfortable and making the CPR course just something that people dread. All right, so Susan, welcome. Would you please tell us the reason why you are a CPR instructor?
Sure, I am a CPR instructor. I am also a nurse. My background is.
Happy Nurses Week.
Thank you. Happy Nurses Week to you too. It's been a great week. So my background is in critical care, but as my career evolved, I got away from that day-to-day clinical. I did leadership, and now I do quality. In the facility I work in now, which is a behavioral health facility, I feel like this is one of my clinical skill sets that I can use and share.
Yes.
And a good way to do that is as a CPR instructor. So our team are required to be BLS certified, and I feel like my background lends itself to being able to share the skills.
Yes.
So that is why I am, and it keeps me connected. So that's why I'm a BLS instructor.
Wonderful. Isn't this, these some great stories. All right, so remind me of your name again.
James.
James, I knew that. James, tell me your why.
I work in the security field. The college that I work for has a lot of staff that need CPR certification. And it's easier for me to get it done, especially with my personnel and a couple other departments, if I'm an instructor. I don't have to schedule it, with somebody from the outside or anything. I can do it all on the clock.
Yes, that's really good. So flexibility, in-house training, and you get everybody certified.
Yes, sir.
Awesome. You have your own team of first responders right there until the regular first responders get to you.
Yes.
So nice meeting you also. And then Cindy, for some reason, I know the female students' names, so ask me why I couldn't remember James' name.
Immediately forgot.
All right, so Cindy, what is your why? Why are you a CPR instructor?
So I work for a college. I work in the business office actually, but I do teach CPR for the nurses, students going into the nursing program, and so we do it in-house so that they don't have to go somewhere else, because a lot of them have a hard time finding places to go.
That's really good. So you keep it convenient, and you make sure that your students can start their clinicals on time.
Yes.
Because they have their certifications.
Yes.
All right, so everybody welcome. Let's start with our review. What does CPR stand for?
Cardiopulmonary resuscitation.
What organs are we trying to preserve, trying to
Heart,
perfuse?
lungs, and brain.
Heart, lungs, and brain. I joke with everybody, some of the other stuff may not be working too well, but while you're on top of that chest, keep perfusing. When we say perfusion, how deeply are we compressing on the chest? A third, and that's really important. So you will have a test, and as an instructor, what is the score that you must make on the BLS provider exam? You have to be smarter than the student.
90%.
90%. And so to help you with that test is why we're going over this review now. The test may not say 1/3, it could give inches. And for an adult, that would be 2 to 2.4 inches, but that 1/3 is really important, especially if you have a large patient who's in cardiac arrest, because if the side view of their chest is this big, you can't be compressing 2 inches. You bring that chest in 1/3 of the way. Why do we allow chest recoil, Cindy?
For the heart to refill.
Give it time to refill, perfect. Minimizing interruptions, James. How long can we take our hands off the chest max?
10 seconds.
10 seconds. Follow-up question to that. If a victim who is in sudden cardiac arrest vomits, but you're by yourself, do you turn them to the side to let their airway drain out?
You start compressions.
You start those compressions because our priority right now, once they're in cardiac arrest, is not ABC, airway, breathing, circulation. Once someone's in cardiac arrest, your priority is CAB. And this is what I want you to think about. If you turn the victim to the side, and of course, left side would be preferred, but if you turn them to the side so they can clear out their airway, what happens to the blood flow to the brain?
Stop.
It stopped because you're not doing chest compressions. So you prevented pneumonia, or at least you hope you prevented pneumonia, but in the end, you caused brain death. So if someone vomits and you're by yourself, I need you to maybe turn their head within 10 seconds, sweep out their mouth, but you go back to high quality chest compressions. If we can get ROSC, what does ROSC stand for?
Return of spontaneous circulation.
If we can achieve ROSC, they're going to intubate, they're going to suction, they're going to give antibiotics, and we have time to fight the infection that they could have in their lungs. But if you just turn them to the side, we're not going to be able to reverse that brain death. All right, so we talked about minimizing interruptions. Can you use an AED on a pregnant mother?
Yes.
Yes. Why are women more likely to die from sudden cardiac arrest if the arrest occurs outside of a hospital? Think about our anatomy. Have you all ever seen a woman on TV go into sudden cardiac arrest or have a heart attack? So there's a perception that women don't have heart attacks, that women don't have heart disease, and definitely if you have to expose someone's chest on TV and breasts are exposed, oh my God, you've committed this massive offense. But now women and men die at the same rates from sudden cardiac arrest. But if you're a woman outside of a hospital, you're less likely to receive care because no one wants to touch or expose your breast. What law would protect a man if he was providing, if he was touching a woman's chest to perform chest compressions? What's the law?
Good Samaritan.
The Good Samaritan law. So as an educator, what I want you to do for those male students, just make sure you let them know that they can still provide chest compressions, that women die. If a woman's on the ground, it may not be because she had an anxiety attack. It could be because she's actually in cardiac arrest. Start doing those compressions on top of clothing. And then whenever somebody who feels comfortable comes, they can expose the chest. Why are we exposing the chest in preparation for what?
AED.
The AED, okay, and the AED, what is the role whenever it sends that shock to the heart? What does that shock do?
It will
Establish a regular rhythm.
Establishes a regular rhythm, that's the goal. So you can be doing the best CPR, but after a few minutes, you're gonna get tired. That's why you wanna introduce that AED, that defibrillator, really fast, because if it can shock the heart and get it back into a perfusing rhythm, we've done a really good job. What's the recovery position?
sideline.
Sideline. Why do we put them on their side after an arrest? And they have ROSC. Why do we put them on the side? In case they do what?
Vomit.
Vomit. Okay, and that's going to help try to keep their airway. So we can focus on their airway once they have a pulse again. But if they don't have a pulse, our priority is those high quality chest compressions. So what rate do we compress? How fast? How many per minute?
100.
100 to 120 per minute. All right, so we've done a really quick review. If you all will look at those sheets that are on your tables. And if you have any additional questions, we'll go over pediatric next, but we're gonna focus on one age group at a time. So right now we're on adults. And just let me know if you have any questions before we go to the actual skills portion. You good, James?
I'm good.
All right, Susan, you're good?
I am good,
All
thank you.
right, so let me go ahead and move this camera. All right, and for our students who are out there in YouTube land, our wonderful instructors have given us permission to record them so that we can help you all actually be prepared for your instructor courses. So if I can get you all to stand up. Right here. All right, so come on closer. All right, and so I'll trade places with you all. So so you're here. All right, so James, can I get you right here, please, sir? All right, so whenever we're doing our initial assessment, before we approach the scene, what are we checking for?
Safety.
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 Look left, look right. If the scene is unsafe, what do? If the scene is
Trying to make
unsafe,
it safe. Or
you're a safety person. I'm not.
you're gonna call for help.
Call for help, yeah.
He's like, look, this is what I get paid for, to secure the scene and make it safe. All right, so it depends on what your responsibilities are, but for the rest of us, especially for your students, you want to make sure that they remain safe, because if they injure themselves, they're not gonna be able to assist anybody else. So I look left and I look right. I see a person who's on the ground. What do I do now?
Trying to determine if they're
Check.
responsive or not.
All right, so I'm gonna check for responsiveness. Hey, are you okay? Are you okay? Whenever we press play on that DVD for the American Heart Association courses, at this point, when the person is unresponsive, we don't wait to check for a pulse. When you determine that someone is unresponsive, you call for help. What is a medical reason that someone could be unresponsive but still breathing? It's a lot of them.
There's a lot of them.
Okay,
Could
so
be a drug overdose.
drug overdose, and we'll show you how to use the Narcan trainer. What about somebody who's a diabetic? Okay, so all of those, either way, they're not responding to you. You still must go get some help. So hey, you call 911 and come back.
Okay.
Notice I said come back, because I don't need you in the car filming me. All right, so the person who comes back to assist you, do they have to be certified in CPR to render aid?
No.
No, they do not. And so you can help, even if it's just having them take over chest compressions for a few moments, so you can get some rest, and then you can go back to your compressions. So I check the scene, I tap and I shout, I check for responsiveness, he didn't move, hey, you call 911 and come back. How do I know if I need to start chest compressions? What two things do I check for simultaneously?
You're gonna check for
Breathing
pulse.
and pulse.
Okay, breathing and pulse.
Yeah.
Old school is this. You don't have to put your face that close to theirs. All right, so I'm gonna take my two fingers on the side nearest me, check for the carotid pulse. At the same time, look for chest rise and fall. 10 seconds max. There's no breathing, there's no pulse. 911 is now on the phone. They're gonna ask you what the emergency is, and they're gonna ask you, do you know CPR and do you have an AED? All right, so I'm gonna also ask for you to bring the AED. Think about your campuses and your workplaces. Are your AED kits somewhere central, and are they near a first aid kit?
Yeah.
Yes. So that's gonna be something you work on. Because otherwise, you gotta have a run west wing to go get the AED and east wing to go get the first aid kit. So that I would recommend you kind of bring those closer together.
Yeah.
All right, so now that I've given you all extra homework, all right, so you're
Yeah.
gonna walk around, and then, as far as your staff, an easier way for me when I go to these organizations to get the staff to learn how to use their AEDs is during the CPR classes, I actually start, the video. So you can just go to YouTube and you can see the video of the trainers that you all have, the AEDs that you have. You can show them how to work that AED. Another option, which is more expensive, is for you to buy the AED training device that matches the AEDs you have on your campus. Either way, they need to know how to work their AEDs, especially since you usually have the same make and model throughout the campus. So, all right, so I need to start CPR. Hand placement. Move the camera a little bit. I'm gonna move it back over here, James, I apologize.
You gonna go with this one?
Just a little. Making students dizzy. All right, so hand placement, where should my hands be placed?
Yeah, along the breast line.
Okay, along the breast line, can I press way down here?
No, you wanna avoid the tip of the sternum.
Okay, awesome, and so we'll call it the xiphoid process, and when I compress, how deeply do I compress?
1/3 the depth of the chest.
What are the feedback devices that the Manikins approved by the AHA? What must they monitor?
Depth and,
And the rate.
All right, so we're gonna monitor depth and rate, so when I press down deeply enough, what should you hear?
click.
Okay.
When I am at the appropriate rate, what will you see?
2 green lights.
2 green lights. What does that fast orange light indicate?
Too fast.
Too fast.
What would the feedback be during your class?
You need to slow your rate.
Can you slow your rate? And if a student still can't get it, how would you help them maintain their pace? What,
Count with them.
count with them, okay? And so, I'm having a hard time, what would you do?
1, 2, 3, 4, 5, 6, 7, 8.
And that's how how you can help assist your students without trying to touch everybody, because you could have a large group. All right, so now that we've done that practice, I am going to ask that, would you please, Susan, bring the back mask device over? All right, so instructors, would you please tell me how to use this?
So you need to place the mask over the nose and the mouth
Okay.
using your CE grip. Your E goes down and lifts the head back, make sure
Okay.
you got a good seal. And then in order to give the breath, you're gonna push about a third pressure, that's way too hard. You need to, just a little bit,
Just a little
until
bit.
you see that chest rise,
That's all it takes?
that's all it takes.
All right, and so, can you work this bag by yourself?
You can, it's more effective if you have two people, but you can work it by yourself.
So let me rephrase the question. If the victim's in sudden cardiac arrest and you're the only rescuer, should you be coming to the head of the victim to use this bag? No,
No.
because you have to minimize interruptions. You can't take your hands off the chest for longer than
10 seconds.
10 seconds. So can I please get you, Cindy, to trade places over here with James? James, you're now going to be rescuer number 2. Cindy, you are rescuer number 1.
Okay.
Okay, and so this has now, we've gone from adult, so well, actually, let's do a round with adults.
Okay.
So if it's 2 rescues for an adult, what is the ratio of compressions to breaths? 30 to 2. All right, so let's go ahead and start. All right, hands on the chest. All right, and remember, for classroom purposes, we're using this table as our simulated medical bed. But if your students are, yes, all right, and so I'm gonna line your hips up and let's count together, let's go. Has to hear you.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, hover and get those 2 breaths, almost. Let's try again. Did you
The
get a
breaths?
breath? I didn't see him go in, James. Try again.
Oh, I'm sorry.
No problem.
There you go.
Okay, good. Let's go. Keep that place, position.
1, 2, 3, 4, 5, 6, 7,
Don't go too
8,
fast.
9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 8, 30.
2 breaths. I think I see the air where it's escaping from. Okay, so go ahead. So you keep compressing while he fixes that.
Stop.
Four, 5, 6, 7, 8, 9,
That sounds like it's way too fast.
12,
15, 16, 17, 18, 19, 20, 21. Count with them, Cindy. 24, 25, 26, 27, 28, 29, 30. Hands up. 2 breaths. Last cycle, Cindy, let's go. I'm going to work with his hand placement. Would you help him with his hand placement? I think his C is too big.
8,
Cindy, count. You have to count, Cindy. If you count, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Raise up. 1. I heard that one go through. Let's give it a second one. 2. There we go. Last cycle, Cindy. Count for us.
2, 3, 4, 5, 6, 7, 8, 9, 10,
Perfect.
12,
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, great job. 2 breaths. Great job. Now, Cindy, would you please take over airways? All right, and then James, you all have 10 seconds to switch. So James, while she's getting in position, would you start your compressions? And then would you help Cindy with her hand placement?
5, 6, 7, 8, 9, 10, 11, 12.
Her airway's not open.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30.
And hover, so Cindy can see. 1 and 2. There we go. Great job. Keep it open, Cindy.
1, 2, 3,
I recommend using your leg against his head.
9, 10, 11, 12, 13,
Count with him, Cindy.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Great job. Oh, I'm not sure what happened that time. Try it again. 1. We'll say it went through. All right, you continue your compressions while she fixes her mask.
2, 3, 4, 5, 6, 7,
Don't lift your arm too much, Cindy.
Don't look.
Mm-mm. So just-
15,
So tight, see?
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
It's our last cycle. 1
Good.
and 2. Last cycle. Let's go. Keep that, Cindy.
1, 2,
Count with them, Cindy.
4, 5, 6, 7, 8.
Perfect. Let that chest recoil.
14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
1, and we'll just say those 2 went through. Awesome. Great job. We'll just say it went through. Susan, can you please get the AED for us?
Yes. Let me see, where is the?
I do apologize. Yes, great job, everybody. All right, so I have it hidden over here next to the entrance.
Oh, there it is.
I'm sorry about that. No problem. All right, so you all now talk me through. When the AED arrives to the scene, what's the first thing you do?
Turn it
Turn it
on.
on.
Turn it on. And then we want to follow the pump. So I'm not gonna turn it on just yet, because I don't want it to overtalk me. Your pads have an image that shows you the pad placement. Can we use an AED on a pregnant mom?
Yes.
Yes, we can. Okay, nothing changes. We need to save mom and save baby, so we're gonna utilize that energy. This pad will go here, and then this pad will go here. What I find is that students put the pad too far down. It's like they're trying to defibrillate the stomach. Think of where the strongest part of the heart is and have the pad nearest that. And of course, in your classroom settings, they can peel and stick. For our classroom, we just have them placed. In the real world, they'd have to peel and stick. What do you do if the victim has a hairy chest and the pads are not sticking?
Shave it, or
Shave
take
it.
a pad and rip it off.
Or for all the men, just go ahead and shave your chest for us. I mean, come on now. Help us out, go ahead and shave it some way. So let's say we have 2 sets of pads, I recommend using those pediatric pads. And you would place them and rip them off. And that would give you a clear circle to apply your adult pads. So it's going to tell us next to connect it. Once we connect it, it is going to say analyzing heart rhythm. Can we be touching and providing compressions while it's analyzing?
Yes.
Yes.
No,
no.
because if I'm touching, whose heart is it also analyzing?
Oh, yeah.
Mine.
Okay.
So when it says analyzing, I want you all to say clear, analyzing. Clear. All right, and so then it's going to determine whether or not a shock is needed. It may say shock advised. This is made for laypersons, so when you are training your safety professionals, I need you to use the AED as it is intended. When you're training nurses and doctors and medical professionals, when it says shock advised, stand clear, we ignore that because we are professional rescuers. During that time when it is charging, we are not hurting anybody by going back and providing compressions. We're actually helping to perfuse the brain. So to repeat that, analyzing, you all say clear. When it says shock advised, charging, you all say compress. Say
Compress.
And then it's going to say, deliver shock now. Can you press that button while I'm on top of the chest? No, what do you say?
Clear.
And that's when you would press the shock button. Let's see if you all have it. Susan, everyone else has had their turn.
All right, here I am.
Susan, here you go.
All right.
All right, and so you can tap or you can compress. Just make sure you're counting out loud, okay? Let me step out the way.
Do you want me to go ahead and turn this on? Or?
Yes, you're gonna do everything with the AED, all right? And so you're gonna work around James.
Okay.
You're gonna turn it on. Press it hard.
Apply pads
Count for us,
to
James.
patient's bare chest. Plug in pads
Really
connector
pillow,
next
count,
to
you gotta
flashing
count for us,
light.
James, don't stop, count,
1, 2, 3, 4.
Don't go too fast, 7,
Apply pads. Plug in connector.
13, 14, 15, 16, 17, 18, 19, 20.
21,
23, 24, 25, 26, 27.
Analyzing heart rhythm.
What do you say?
It's
Clear.
clear.
Do not touch the patient.
My husband.
Don't touch.
Don't touch.
Good shot.
Shock advised.
All right.
Go ahead. Start compression.
Charging.
Look at his hand placement.
Stay clear of patient.
Stay clear.
Clear.
Deliver shock now. Press shock delivered.
Please switch out. Switch out, you have 10
Begin
seconds. Ready to
CPR.
start compressing? So I want you to hear this tone.
6,
Hear this
7,
tone?
8. This will go with it. 2, 3, 4, 5, 6,
And gotta count for us, Cindy.
9, 10, 11, 12.
You're going faster than the tone. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Great job, you all can stop. Great job. And now I want you to repeat after me. Say, I am turning the AED off for classroom purposes only.
I'm turning the AED off for classroom purposes only.
Say it also, James.
I'm turning the AED off for classroom purposes only.
Cindy?
I'm turning the AED off for classroom purposes only.
Perfect. Because I've asked students, what do you do next? And because they saw me turn off the AED,
I think they turned it.
they
off.
turn off the AED.
Yeah.
So it's really important for them to know that even if a person achieves ROSC, and what does ROSC stand for?
Return of spontaneous circulation. Sorry.
So they could be talking to you, which usually after an arrest, they don't just, spring back up and start talking to you, but maybe they're moaning. Do not turn the AED off. Because if you think of DeMar Hamlin, after he regained a pulse, what happened in the back of the ambulance? Did you hear that story?
Lost it.
He lost it again. How often is this going to reanalyze?
It's gonna, every 2 minutes.
Every 2 minutes. What should you and your partner do? The compressor, every 2 minutes.
You should switch.
Switch.
So every time this reanalyzes, that is your cue to be switching out. You can switch out sooner if what happens?
You become tired.
Very good, very good. All right.
That makes sense.
Woo! All right, so we have 2 more things to practice. Any questions on the AED use? Can you use an AED on an infant?
Yes.
Yes, and a child. And if you have the adult pads, what will be the placement?
Front and back.
Front and back. They cannot touch. Very good. James, would you please do me a huge favor? Would you please take the adult and bring it over? And then Cindy, would you bring the infant over here? And child CPR is very similar to adult CPR, except for if there are 2 or more rescuers with a child, what is your ratio of compressions to breaths?
15 to 2.
Why? What are we giving more of?
More
More breath.
More breaths, okay. And so, can you use 1 or 2 hands? Does it matter if it's a child victim, not an infant, for a child? Can you use 1 hand? Can you use 2 hands? What's the rule?
Yeah, whatever,
Yeah, you
for
use
a
whichever
child,
works
you
best.
can use whatever you need to compress the,
Yes.
yeah.
And so what I like to think of is, let's say the child, and of course, we pull the infant out, but we're still talking about child CPR. Let's say that the child doesn't live, and I performed one-handed CPR. What am I gonna be stuck with for the rest of my life as a rescuer? Did I?
No,
You pressed it hard.
Did I not? So for a child is from 1 to what stage? 1 to
Puberty,
puberty.
Puberty.
How would you know if a young lady has reached puberty?
breast development.
Breast development. How would you know? So my son is almost 11. Really goofy, has on a SpongeBob
Like
t-shirt.
hair on their chest.
But he is 120 pounds and he's 5'2".
He's adult size.
He's
Adult
adult
size.
size. So I need for you to use those 2 hands and really try to save his life. How deeply do you press on a child?
1/3.
1/3. If it asks you for a test question, how many inches?
2.
2 inches. All right, so now we're going to infants. I need to switch out so that way it's not so awkward. Okay, so let's talk about the abdominal thrust, because we talked about if a child or infant goes into cardiac arrest, more than likely it was not due to their heart, it was due to their lungs. So on your own bodies, show me how to perform what we called previously the Heimlich maneuver. We now call it abdominal thrust. What do you do?
So take your fist
Yeah.
in between the
Okay.
belly button and the rib cage,
Okay.
and you thrust up.
Okay, good. What do you do if the person's pregnant? And yes, you have 10-year-olds who can get pregnant, so, so what do you do if the person's pregnant?
Over
You-
the breast.
Okay, over the breastbone. Avoid the xiphoid process. So center the chest, nipple line, and you go straight in. You'd also do that if somebody was obese and you could not get your arms around them.
Okay.
Yep, you couldn't get them around their stomach, you're gonna go here to the center of their breast. So now let's talk about this infant. Oh my God, I had 2 pennies on the table. My infant doesn't look right, and now there's only 1 penny on the table. First of all, bad mom.
Yeah, exactly.
So prevention is really important with kids. We need to prevent having those small objects around. Make sure the pools and stuff are locked. Otherwise, we know everything goes into their mouth.
Yes.
I look in the mouth, I do not see anything, okay? But I can kind of like hear like a whistling or a wheezing sound. What do I need to do now? Help me out. If I have a chair, I can be seated, but let's say there's no chair nearby.
So you
5 back thrust,
Back,
5
and-
chest thrust.
And for
Abdominal.
What do I do?
So you're gonna you're gonna support the infants.
So notice how I'm trying to get you to teach without touching.
Yeah, place your arm, that's right, you can support
Yes.
it, right?
Okay, I'm not
Not around the neck.
choking.
Not around the
Okay, good,
All
okay.
right, so you're gonna be in a downward direction, which you are,
Okay.
and you're gonna give 5 back blows,
And
as if go upwards,
Yeah.
so that you'd be pushing the object
Ah,
forward,
okay, so 5,
right? 5.
okay,
Okay, now you're gonna use that arm, you're
Support the
gonna,
back of the head
you wanna
with that
support the
arm.
baby with the other arm, so you're gonna flip them, perfect. A
okay.
little bit of a downward, and you're gonna give 5 chest thrusts. 4,
Okay. I see it.
okay.
Which finger do I use to get the object out? Do I wanna use a thumb, an index finger, a pinky? What do you think about this baby's small airway?
I would use a small finger.
yeah.
Use a
Use the
small
littlest finger
finger,
possible.
yes, and think about the difference. So you have safety professionals, so you can have some really big athletic men, you can have some women who have long fingernails, cut off those fingernails if you take care of kids, but I still recommend that you use the smallest finger and do a sweep. Can we do a blind sweep? Can I just be in there digging blindly? No. Please reteach what was just taught. So this is our teach bag. My baby must have a penny in his mouth. What do I do?
Turn him over
Okay,
and do support the head,
okay.
put him, face him down a little, and 5 backs. No, towards like that. Yeah,
5,
okay, turn him over, support the
Take that
head,
hand.
okay.
and then 5, no, up here. Oh, what's
Chest
Just
thrust.
thrust.
chest thrust, so much was it?
All right, good, so I did 5, all
And
right,
then turn him over.
okay, and just keep repeating the
Yes.
process? When will I know, how will I know
Look
when
in
to
the
stop?
airway, yeah, I guess you could look in the mouth.
I could,
Yeah.
okay, I don't
Yeah.
see anything, but my baby still has a whistling sound.
So you keep
Repeat.
doing the same thing.
Okay. When will I stop?
You would stop when you either got the item, sorted the item and able to sweep it out, or you didn't hear that anymore and the baby became unresponsive, and then you would start chest compressions.
Baby's now not moving. All right, so what do I do now?
Now we're gonna,
High quality
CPR.
Okay, hand placement, what's the hand placement?
Well, you can either use 2 fingers,
Okay,
just above the breastbone there, and you just wanna get a,
perfect, and I'm turning lights on, so even the infants have a feedback monitor. Okay, we'll just pretend it's on, all right, awesome. Okay, so now, as an instructor, instead of you physically doing it, because remember, we may have up to 10 students, I want you to talk me through the process,
okay, so you can either use a 2 finger like I showed you there,
okay?
or you can use your thumbs. You
Okay.
wrap your hands to the back of, and support the back, and you put your thumbs in the middle, and you compress.
Okay,
So I want you
does
to
it
get
matter
that.
which way? I could do either way?
You can do either way,
Okay, all right,
whichever's more comfortable and you get a better compression.
okay.
So-
Can I do this on the sofa?
You want a hard surface, you don't wanna,
So
you
I
wanna
have to
place
take
the
them out
child
the
on a-
crib?
place the child on a firm, flat surface,
Okay,
even if you have to go to the floor, then you're gonna use a 2-finger method, or you're gonna use the fingers wrapped around and using your thumbs.
okay,
You're gonna do 30 compressions
okay,
if you're by yourself.
okay. And then, it-
You're gonna be trying to, you're gonna give breaths after 30.
okay, do I just squeeze the infant's nose and give the breath?
No, if you're giving the breath to an infant, you're gonna try and cover both the nose and the mouth with your mouth.
Very
If that
good.
doesn't work, then yes, squeeze the nose.
Okay,
But you should be able, most adults can cover the mouth of the child
Okay.
and the nose.
very good.
So
All right, then last question. When the AED arrives,
when the AED arrives, you wanna turn it on,
mm-hmm,
and it's gonna instruct you as to what to do. But
Okay.
while you're preparing the AED, or whoever's preparing the AED, you're still doing compressions and you're still doing breaths.
okay.
If you've got 2 rescuers, you've got 15 compressions and 2 breaths.
Why is that?
Because usually it's a respiratory issue with a child or an infant, and they need more breath. than
I am
compression.
loving everything you're saying. Give them applause, everybody. Very good job. All right, so the AED pads that we have are the adult pads.
So you're gonna place the adult pads, one in the front
Mm-hmm,
and one on the back. They
okay.
don't touch each other.
All right, so to help you pass your test, we just got a couple more things to talk about. At the end of the course, you all have an instructor exam, and the instructor exam may have questions or terms such as feedback and debriefing. When you think of feedback, does that happen after a skill or during a skill?
During.
During. And so you want to provide appropriate feedback, and I try not to just tell people what they're doing wrong, and they be like, okay, according to the American Heart Association, that way they won't be mad at me. According to the American Heart Association, if you can just move your fingers a little, maybe like an inch above of where you are, because we want to avoid the xiphoid process. What is debriefing? Like, when is it given?
That's at the end of the event.
At the end, so like after your mega code or your team scenario, is debriefing me pointing my finger at you and telling you everything that you did wrong?
No.
You killed them, you didn't do right, you gave the wrong medication, you didn't start the IV fast enough. So is debriefing instructor guided?
No.
Okay, so I'm gonna step out and then allow you all to talk amongst yourselves and tell us what went right, what we could have improved upon. Cindy, what is the sandwich technique whenever you are evaluating someone or helping with a debriefing? Have you ever heard that before?
No, I have not.
Have you heard it, James? Sandwich?
No, especially open with a
Good.
piece of bread, you put all the information on it and you close.
Okay.
So you have to start with love and you end with love, and in the midst, you somehow very nicely tell them what improvements need to be made, okay? So that would be the sandwich technique. What questions do you have before you take your first break and then your first test? I'm so proud of you all. Let's get this done. Let's get your certifications renewed. All right, great job, everybody.
Yeah, you guys are really good.
Really?
I am very
He
impressed.
just took
Yeah,
it
no,
to
you're
the
really
ground.
good. But you know what, you can see that you really